Have you ever felt a sudden, unsettling change in your body and wondered if it was serious? We often try to shrug off discomfort or attribute it to minor issues. But what if those subtle shifts are actually urgent cries for help? Today, we are going to reveal 6 critical warning signals your body might send that absolutely demand immediate attention from medical professionals. If you're watching this video because you're concerned about your health or the well-being of a loved one, comment "reveal" below. These aren't everyday aches and pains. These are the red flags that healthcare experts emphasize should never be ignored, not even for a moment. Hesitation could mean the difference between a swift recovery and a devastating outcome. This isn't about instilling fear. It's about empowering you with the knowledge to act decisively when it truly matters. Many individuals, particularly older adults, sometimes delay seeking medical assistance, perhaps thinking they are being a bother or that the issue will resolve itself. However, in numerous situations, prompt intervention can prevent a small problem from escalating into a life-altering crisis. Understanding these vital signs puts you back in the driver's seat of your health journey. In this video, we will delve into 6 specific physical symptoms that doctors stress you must never disregard. These aren't vague feelings. They are distinct, tangible indicators, and in many instances, time is of the essence. Stay with us until the end, as recognizing just one of these signs could potentially save your life or the life of someone you hold dear. Now, let's get straight to it. 1. Abrupt speech difficulty or facial weakness. There's a particular cluster of indications that medical professionals are trained to recognize instantly, and they point directly to a medical emergency that simply cannot wait: a stroke. If you suddenly experience trouble articulating your thoughts, find that your spoken words are garbled, unclear, or slurred, or if you observe that one side of your face is not moving in sync with the other, you must seek hospital attention without delay. The same urgency applies if you find yourself unable to lift one of your arms, or if it involuntarily drifts downwards when you attempt to raise it. These are not signs to dismiss or hope will go away with rest. They are strong indicators that your brain might be in severe distress. A renowned neurologist once stated that for every minute a stroke remains untreated, an estimated 2 million brain cells are lost. Time isn't just a valuable resource. It represents memory, the ability to speak, physical movement, and indeed, life itself. This is a stark reality that many individuals don't fully grasp. In older individuals, strokes can occur unexpectedly. Someone might be enjoying a typical day, perhaps reading the newspaper, watching television, or having a meal, and suddenly their words don't form correctly, or their smile appears uneven. These subtle alterations might feel odd, but not necessarily alarming, and that's precisely what makes them so perilous. Because when it comes to a stroke, the quicker you receive medical intervention, the greater your likelihood of a positive recovery. Consider the experience of Michael, a 70-year-old retired firefighter from Chicago. One morning, while enjoying his breakfast, he unexpectedly dropped his fork from his left hand and couldn't comprehend why. He tried to call out to his wife, but the sounds that came out were jumbled and didn't make sense. His wife, Sarah, immediately noticed that one side of his mouth was drooping and swiftly dialed 911. Michael received critical treatment within the first hour and made a significant recovery. If Sarah hadn't acted so promptly, I might have been permanently disabled, he later recounted. The medical community employs the acronym FAST-FACE, ARMS, speech, time to educate the public on how to identify a stroke. However, the most crucial element, often overlooked, is the final letter, T for time. This underscores that every minute is crucial. If you observe any signs of slurred speech, facial asymmetry, or sudden muscular weakness, do not hesitate or wait for a scheduled doctor's appointment. Immediately contact emergency services and get help. When your brain is in jeopardy, rapid action can be the deciding factor in preserving your ability to walk, speak clearly, remember cherished moments, and maintain your independence. If you've learned something important about recognizing stroke symptoms, please comment "brain rescue" below. 2. Unexpected chest pressure or discomfort. One of the most critical signals your body can send is a sudden, unexplained sensation of pressure or discomfort in your chest. This might manifest as a feeling of tightness, a squeezing sensation, or even a burning feeling, and it can radiate to your arms, shoulders, neck, or jaw. While some individuals might attempt to rationalize it as mere heartburn or anxiety, the truth is that this could be your heart desperately signaling for help. This is particularly critical in older adults, as the indications of a heart attack can be subtle, develop gradually, or present in ways entirely different from what one might anticipate. A seasoned cardiologist once shared that the number of patients who arrive at the hospital too late because they mistook their heart attack for indigestion is truly heartbreaking. If there's even a remote possibility that the discomfort is cardiac in nature, it is imperative to get it checked out immediately. This statement carries significant weight, especially when considering that many heart attacks in seniors do not present with the crushing chest pain often depicted in media. Sometimes it might be a dull ache, a fluttering sensation, or simply an unsettling feeling that something is not right. You might also experience dizziness, shortness of breath, or sudden, unexplained fatigue, even without any preceding physical exertion. These are not symptoms to simply monitor. They demand immediate action. Consider the experience of Tricia, a 76-year-old retired librarian from Denver. One afternoon, while relaxing in her favorite armchair and reading a book, she felt a strange tightness in her chest. It wasn't intensely painful, but it persisted. "I initially thought it was just indigestion," she admitted, "but something deep down told me to call my son." Her son, Mark, arrived quickly and insisted on taking her to the nearest hospital. It turned out that Tricia had experienced a mild heart attack. Thankfully, due to the swift action, she received timely treatment and made a complete recovery. "If I had waited any longer, I might not be here today," she reflected. "Now, I pay much closer attention to what my body is telling me." The crucial lesson here is that when your body is in distress, it doesn't always scream. Often, it whispers. And with something as serious as potential heart trouble, those whispers can be a final warning. Do not wait until the pain becomes unbearable, or you find yourself unable to breathe. If you experience any unfamiliar, persistent chest discomfort, especially if it's accompanied by other symptoms, seek immediate medical attention. Do not second guess or delay, just go. If you are still engaged with this video and finding these insights valuable, please comment "Heart Alert" below to acknowledge you're with us. 3. Intense or rapidly escalating abdominal pain. We all encounter minor aches and pains from time to time, particularly as we age. However, when that pain becomes sharp, arises suddenly, or feels like it's intensifying rapidly, especially in the abdominal region, it is not something to simply ignore or try to wait out. Severe belly pain can be indicative of a serious medical emergency, such as appendicitis, a perforated ulcer, pancreatitis, or even internal bleeding. In older adults, abdominal pain can also signal a blocked intestine or a ruptured organ, both of which can be life-threatening if not addressed promptly. A seasoned trauma surgeon once emphasized that when a senior citizen reports sudden, severe abdominal pain, medical professionals take it extremely seriously because the window of opportunity for effective treatment can close quickly. This perspective is crucial to remember because, for older individuals, the risk of complications is higher, and the typical signs of illness might not always present in the same way they would in younger people. You might not even have a fever or noticeable swelling. You might simply feel profoundly unwell, or you might suddenly double over in excruciating pain without any prior warning. Regardless of the specific presentation, your body is communicating that something is seriously amiss, and you need to respond without delay. Let's consider the experience of George, a 74-year-old retired accountant from Phoenix. He prided himself on his resilience. One evening, while finishing his dinner, he experienced a sudden, stabbing pain in his lower abdomen. He initially dismissed it as gas, took some over-the-counter antacids, and went to bed. By the following morning, the pain had spread throughout his abdomen, and he felt too weak to even stand. His daughter, noticing his distress during a morning phone call, immediately called for an ambulance. Upon arrival at the emergency room, the medical team discovered a twisted section of his intestine that had completely cut off blood flow. Emergency surgery was required and ultimately saved his life. "I really thought it would just pass," George later admitted. "I didn't realize how quickly things could deteriorate." This type of scenario is not uncommon. Seniors often tend to minimize pain or delay seeking help to see if the discomfort improves on its own. However, when the pain is sharp, persistent, or unlike anything you have experienced before, it is not the time to try to tough it out. It is the time to seek immediate medical evaluation. You have nothing to lose by being cautious, but you could potentially lose everything by waiting too long. If you experience intense abdominal discomfort that does not subside, particularly if it is accompanied by nausea, vomiting, or dizziness, do not hesitate or try to self-diagnose. Go directly to the nearest emergency room. If you found this information about abdominal pain crucial, comment belly sauce below. 4. Persistent vomiting or vomiting blood. Occasional vomiting, perhaps due to a bout of food poisoning or a stomach virus, while unpleasant, typically resolves on its own. However, when vomiting persists for several hours, or if there is any presence of blood in the vomit, it transitions from a minor inconvenience to a serious medical concern. Continuous vomiting can lead to severe dehydration, electrolyte imbalances, and even kidney complications. The act of vomiting blood, regardless of the quantity, can indicate a much more dangerous underlying issue, such as bleeding in the stomach, a tear in the esophagus, or ruptured ulcers. A knowledgeable gastrointestinal specialist once stated unequivocally that blood in vomit is never normal. It is one of the most immediate indicators of internal bleeding, particularly in older adults, and should prompt immediate medical attention. This sign should stop anyone in their tracks. Yet some individuals might dismiss it or misidentify the blood. The blood might appear bright red, or it could have a darker, grainy consistency, resembling coffee grounds, which might seem unexpected. In either case, it is a clear signal that something is significantly wrong within your digestive system. For seniors, this could be a reaction to certain medications, such as non-steroidal anti-inflammatory drugs, a complication of an undiagnosed medical condition, or even stress-related damage to the lining of the stomach. Consider the experience of Catherine, an 81-year-old woman from Miami who had been taking over-the-counter pain relievers for her arthritis. One evening, she began vomiting shortly after dinner. Initially, she suspected the fish she had eaten, but when she noticed dark flecks in the sink, which she initially mistook for old food particles, her grandson insisted on calling for immediate medical assistance. At the hospital, doctors diagnosed her with a bleeding ulcer that had been developing silently for months. "I had absolutely no idea it was that serious," she admitted later. "But if I hadn't gone to the hospital that night, I might not have survived another day." This is a warning sign that cannot be overstated. Vomiting blood is not something to wait until morning to address. It is not something that will resolve with rest or home remedies like ginger ale. It signifies that something within your body is damaged and is leaking into areas where it should not be. Whether it's a damaged stomach lining, liver complications, or a ruptured blood vessel, only immediate medical intervention can determine the underlying cause and stop the bleeding in time. If you found this information about vomiting blood critical, comment red flag vomit below. I believe you're enjoying this video and finding this information incredibly valuable for your health awareness. Before we continue to the next crucial warning sign, make sure you subscribe to our channel if you haven't already. Give this video a thumbs up if you're finding it helpful, and share it with your friends and family who might also benefit from this potentially life-saving information. Your support allows us to continue creating informative content like this. Comment wonderful below if you are indeed enjoying this video and finding it beneficial. Now, let's move on to the next vital warning sign. 5. Sudden onset of confusion or disorientation. When an older individual suddenly becomes confused, forgets familiar names or places, or seems disoriented about their surroundings or the time, it's easy to attribute it to normal aging. However, a rapid decline in mental clarity, particularly if it's a significant departure from their usual state, is one of the most serious warning signs there is. This type of sudden confusion could indicate a stroke, a brain infection, dangerously low oxygen levels, or even a severe adverse reaction to medication. Each of these possibilities requires immediate medical attention. A hospitalist with extensive experience in geriatric care once shared that in older adults, the brain is often the first organ to signal when something is seriously wrong elsewhere in the body. Sudden confusion, therefore, is akin to the body's emergency light flashing urgently. This observation is particularly important because many seniors and their families might not recognize sudden confusion as a medical emergency. They might mistakenly believe it's just a sign of tiredness or a bad day. However, when the change is abrupt, such as forgetting the names of close relatives, getting lost in familiar environments like their own home, or speaking in a manner that doesn't make logical sense, it is crucial to take it very seriously. These are not gradual memory lapses. They are sudden and significant shifts in mental status that often signal a much deeper underlying medical issue. Consider the case of Dorothy, an 83-year-old woman who lived independently in a quiet neighborhood in Vermont and managed all her own affairs. One morning, her neighbor found her wandering in the hallway of their apartment building, visibly distressed and unsure of how she had gotten there or why she was fully dressed. She seemed agitated and kept repeating the same simple question. Initially, her family considered dehydration or perhaps fatigue as possible explanations. However, when they brought her to the local hospital, she was diagnosed with a urinary tract infection UTI that had triggered a sudden onset of delirium. She received appropriate antibiotics and fluids, and her mental clarity returned to normal within a few days. "I had no idea that a simple infection could cause such severe confusion," her daughter later admitted. "Now, I will never dismiss any sudden changes in her mental state." This outcome perfectly illustrates the sensitivity of the brain, especially in older adults. It often responds to other bodily problems, such as infections, lack of adequate oxygen, or even fluctuations in blood sugar levels, before other more obvious symptoms might appear. Therefore, when confusion strikes unexpectedly and out of the blue, do not wait for it to resolve on its own. While it might, the risk of the underlying cause being serious and potentially irreversible is too high to ignore. If the confusion persists or worsens, the consequences can be severe. If you found this information about sudden confusion important, comment "Mind Alert" below. 6. Elevated temperature accompanied by a stiff neck and sensitivity to light. Experiencing a fever is a common sign that your body is actively fighting off an infection or illness. However, when a high fever is accompanied by a stiff neck, a severe headache, confusion, or increased sensitivity to bright lights, it could be a sign of meningitis, a potentially life-threatening inflammation of the protective membranes surrounding your brain and spinal cord. While meningitis is more frequently observed in younger individuals, it can certainly affect older adults, particularly those with weakened immune systems or pre-existing health conditions. When it does occur in older adults, it can progress very rapidly. An experienced emergency physician once stated that if an older patient presents with a high fever and an inability to bend their neck or experiences significant discomfort in bright light, it is treated as an immediate emergency, and all other non-critical tasks are put on hold. This level of urgency speaks volumes about the seriousness of these combined symptoms. By the time these signs manifest, the infection might already be in an advanced stage. The stiffness in the neck is not just a minor discomfort. It's your body's way of signaling that the lining around your brain is inflamed. Similarly, the heightened sensitivity to light is not merely an annoyance. It's an indication that your central nervous system is under attack. For some individuals, these symptoms might also be accompanied by nausea, vomiting, or an intense feeling of pressure, as if their head is about to explode. None of these symptoms should ever be dismissed as just a common cold or flu. Consider the experience of Benjamin, a 78-year-old retired teacher, an avid gardener from a small town in Ohio. One morning, he woke up with a throbbing headache that was far more intense than his usual tension headaches. By the afternoon, he noticed that his neck felt incredibly stiff, making it painful to even look down. Additionally, the sunlight streaming through his living room window felt overwhelmingly bright and uncomfortable. Thankfully, his daughter, who is a registered nurse, recognized these critical signs and immediately took him to the nearest hospital. Doctors quickly confirmed a diagnosis of bacterial meningitis. Due to the rapid intervention, Benjamin received timely treatment and made a full recovery. "I initially thought I was just coming down with the flu," he later recalled. "I had absolutely no idea it could be something so serious." This real-life example underscores the importance of recognizing these warning flares. When your body sends out signals like a high fever combined with a stiff neck and sensitivity to light, it's not an overreaction to take it seriously, and neither should you. These signs strongly suggest that something is aggressively attacking your nervous system. And with meningitis, every hour counts. Effective treatment is available, and it is most successful when initiated early. Therefore, do not hesitate if you or someone you care about exhibits these combined symptoms. Do not wait for a scheduled doctor's appointment or try to sleep it off. Proceed directly to the emergency room and allow the medical professionals to take over. You will never regret prioritizing your health and seeking timely medical attention. But delaying could be a risk you simply cannot afford to take. If you found this information about fever, stiff neck, and light sensitivity crucial, comment meningitis alert below. By now, you've gained valuable insights into the critical importance of paying close attention to the signals your body sends, particularly as we navigate the journey of aging. These 6 warning signs we've discussed are not intended to cause alarm, but rather to empower you with the knowledge to make informed decisions about your health and well-being. Recognizing when to seek immediate medical attention is not a sign of weakness. It's a testament to your wisdom and self-awareness, especially the kind that comes from years of life experience. Understanding that your health deserves immediate attention, not postponement, is paramount. It's easy to sometimes dismiss new or unusual symptoms, thinking, "I'll be fine," or "it's probably nothing." However, as we've seen in the stories shared today, individuals were able to recover and avoid potentially dire consequences precisely because they chose to act promptly. Whether it was recognizing a subtle change in speech, a persistent chest discomfort, or an unexpected bout of confusion, those moments of decisive action made all the difference. And remember, taking proactive care of your health isn't just for your own benefit. It's also for the sake of your family, your friends, and all the people who care about you and value your presence in their lives. Every day you stay safe and healthy is another day they get to enjoy your wisdom, your stories, your laughter, and your love. So, treat your health as the precious gift that it truly is. Thank you for joining us today on this vital discussion about recognizing urgent warning signs in your body. We sincerely hope this information has been helpful and empowering. We would love to hear from you. Please take a moment to leave a comment below and share one key takeaway from this video, or perhaps a personal experience that resonates with the topics we've discussed. Your thoughts and insights are incredibly valuable to us, and reading your comments provides us with great motivation and encouragement to continue creating content that matters. If you found this video informative and helpful, please give it a thumbs up to show your support. If you haven't already, we encourage you to subscribe to our channel so you don't miss out on future videos packed with valuable health information and tips for living a healthier and happier life. And don't forget to share this video with your loved ones. You never know whose life you might touch or even save by sharing this crucial information. Before you go, we want to remind you that our channel is filled with other interesting and informative videos covering a wide range of health and wellness topics. We encourage you to explore our content library and discover other videos that might be beneficial to you and your family. From tips on healthy eating and exercise to insights on managing various health conditions, we have a wealth of information to help you on your health journey. So, take a few moments to browse through our other videos before you leave. And finally, as we wrap up today's discussion, we want to reiterate the importance of remembering these 6 urgent warning signs. 1. Abrupt speech difficulty or facial weakness. If you experience sudden slurred speech or notice one side of your face drooping, seek immediate medical attention. Act fast if you will remember this crucial sign. 2. Unexpected chest pressure or discomfort. Any sudden, unexplained chest pain, tightness, or squeezing sensation could be a sign of a heart issue and requires immediate medical evaluation. Heart check if you'll prioritize this. 3. Intense or rapidly escalating abdominal pain. Severe, sudden abdominal pain should never be ignored and warrants a trip to the emergency room. Belly button alert to show you understand this. 4. Persistent vomiting or vomiting blood. Continuous vomiting, especially if there's blood present, is a serious concern and needs immediate medical attention. Stop the bleed to acknowledge this critical sign. 5. Sudden onset of confusion or disorientation. Any abrupt change in mental clarity, confusion, or disorientation should be evaluated by a medical professional without delay. Clear thinking now if you'll be vigilant about this. 6. Elevated temperature accompanied by a stiff neck and sensitivity to light. A high fever with a stiff neck and sensitivity to light could indicate a serious infection like meningitis and requires immediate medical care. Neck check to show you've noted this. Remember, your body is constantly communicating with you. Learning to recognize these urgent signals and acting promptly can make all the difference in your health outcome. Don't hesitate to seek professional medical help if you experience any of these symptoms. It's always better to err on the side of caution when it comes to your health. Thank you once again for watching. We truly appreciate your engagement and support. Stay healthy, stay informed, and we look forward to seeing you in our next video. Don't forget to subscribe, like, and share this video with everyone you know. And before you go, take a moment to explore the other valuable content on our channel. We've got lots more to share with you.